Hi class, this is Dr. Fawaz and welcome to the lecture topic of setup of a pediatric dental clinic. This topic will be discussed in two parts. One is the online recorded video and part of it face to face when we meet you in person. So let's get started. Let's see what we have to study in this particular lecture topic. At the end of the lecture, you will be able to describe factors for efficient management of children in pediatric dental office. Basically, you'll understand how the office setting influence the child's behavior, and then we need good behavior. So that means our setup of the office should be good, and therefore we must understand what are the different factors which can influence. Then we should also have sufficient knowledge on different designs on setting up of pediatric dental practice, how well we can design, what design specifications probably we need to use. Okay, so let's get started. So essentially the basic objective of designing a pediatric dental clinic is three prong, okay, and actually four prong. So first and foremost, the clinic should be designed in such a way that the children feel safe. Okay, let me get the pointer pen. Laser pointer. Okay, so children must feel safe and loved and well cared. So that means they must have a sense of security when they are in a pediatric dental clinic. So not only will they feel safe, they will also feel comfortable and therefore they will also be in a good mood. Second is the staff are integral part of the practice. So each and everyone working in the dental practice, okay, they have a role to play in child behavior management. So when you're setting up a dental clinic, pediatric dental clinic, we must ensure that staff have certain qualities. And then of course parents, we need to have special we have to give special attention to parents because we have to educate them, we have to improve their awareness about dental diseases, about oral hygiene. So they also must be in the picture when we are designing a pediatric dental clinic. And foremost, when you see the center of the triangle is the dental clinic setting, and it has to be different from a hospital setting or a pediatrician's clinic. Okay, now this is very important because as we will learn in the following slides. So when you are designing a pediatric dental clinic, like I said, we need to differentiate from a pediatrician's office or a hospital. Essentially, because children have place memory and a very strong place memory. They will remember that they have been to a certain place, okay, and then they will remember the experience in that place. So, children have a very strong place memory and they have a very strong remembrance power, especially when there is a bad experience. So, that is the reason why we must understand children in order to plan our clinic, which has to be a different from a hospital setting or a pediatrician's clinic. Okay, so now even the pediatrician's clinic are improving very much, like how we are trying to differentiate from a hospital clinic. So even pediatricians are doing it. So it's okay, just remember that our clinic has to be a different clinic where the children can have a good memory and good experience, so they would want to come back again and again. So in order to do that, let us understand a few likes and dislikes about children, so it will help us to design a clinic. So first and foremost, children like playful environment. No wonder they like to go to park and play every day, even though we are tired and bored, but they're never tired and bored of going to park and playing on the slides and running about and touching things and pushing things. Okay, so they like playful environments. They also like bright colors. Okay, the bright colors like red, yellow, orange. And this is the reason why when you see you go to a park, you will always find that the park is colored with the slides are covered with yellow and red and orange. So this is the reason why they get attracted, they feel nice, children feel nice. Then of course they like open spaces to move around because they cannot sit at one place like us. Okay, they have this tendency to move around, to explore their environment, to explore their spaces, to touch things, okay, to hold things. So they like open spaces to move around. So cramped places will make them very uncomfortable. They like to be received with smiles on faces whoever meets them. So there's a the warmth they can feel, and children are very good at understanding the face behind your face. Okay, so they can read your face. If you're angry but you're smiling, they can sense something is wrong. Okay, so that way they are very innocent. So we must be very humble to them and reflect our true feelings of warmth when we meet them. So they like to touch and feel and play with objects, and therefore, do not always tell them not to do this, not to do that. And our clinic should be such designed that basically it is a safe place for them to touch and play with things. Humor, compliments, praises. Children just love to be praised for their good behavior, and it is always nice to have a sense of humor for the dentist and for the staff, so that the children can converse with you, have a good conversation, and laugh about things, and they will feel very comfortable. So they tend to be big boys. They have a tendency to be big boys. Like girls like to wear the shoes of their mothers, they put on those high sandals. Okay, and the boys want to put on the shoes of their father and then walk around this. That is how they tend to behave like grown-ups. So we should not treat them as little boys and girls, but mini adults. So they like to shake hands, they like to be patted on the backs, they like to give claps, they like to give high fives. So okay, so we need to practice that. They need to have an eye to eye contact while talking, so they know that they are talked to. Okay, they like cartoon films, magic shows, advertisements on TV. They like to talk about games, they like to talk about friends. Some children are very chatty, so they want to tell you about their experience at school, what did they do with friends. So you need to be open to conversation with. So similarly, I have listed out a few more things here, like in terms of communication, right? So children, the I message type of communication, such as I like children who listen to me carefully and follow my instructions. I like children who do not move their hands or face or head when I'm working. This kind of messages children like, rather than you don't do this, you don't do that, don't move your head. Okay, so in those terms, the dental staff and the dentist should be aware that children don't like to be told directly what to do. You just have to say, I like children who do this, and children automatically, to uh, show his good behavior, to please you, he will follow your instructions. So children have to be in their comfortable zone while you're treating them. So they must be seated comfortably, and all their needs, they should not be hungry, and they should be watching a cartoon film on the TV while the dentist is treating them. It kind of makes them more comfortable. They like to win prizes and rewards. Okay, so this also we will see how we can put all this children's likes and dislikes into our clinic specifically. So here we are just trying to list out things that children like and dislike. They like friendly gestures, simple attire of the doctors and staff. Okay, not too serious attire. We will later see in the later part how we can do that. They like to play with the dental chairs. They like to move the dental chairs up and down. Okay, and they will try to switch on things and switch off things. So that is also okay. The part of their personality. The dental chair should be easy for them to get on and get off. There should not be any spittoon. Okay, so they don't try to delay the treatment by frequently expectorating in the spittoon. Okay, and then they have lights button. They like to switch on the lights of the dental chair by themselves. The instruments tray should have minimum things on it. So when you're examining the child, maybe just have a few things on the instrument tray. Try to keep the tray away from the children. Use simple words when you're giving them instructions, and you have to be quick and graceful to your work, right? You have to be efficient. That means you finish quality work in minimum time. All right, and then children like to be told honestly and clearly what they have to do. They don't understand the gray area, they just understand black and white. So you have, when you're telling them that this is going to hurt, that means it's going to hurt. Okay, so don't tell them like it's not going to hurt, then it hurts. Then the children will not have trust on you. So, looking at the layout of dental clinic, right? So here on this diagram are a few compulsory areas that you need to have. You need to have a play area, you need to have waiting area, and you need to have a consulting room. Then you have your dental operatory, and then you have your assistant area. So essentially, the literature says that the layout of the pediatric dental clinic, and for that matter, any clinic, should be a horseshoe traffic pattern, which essentially means that entry from one point and exit from one point. So you see in this picture, you have an entry, all right, and then the children are playing here in the play area while the parents do the front desk registration, right? And then the parents go down and sit here while the children are playing in the play area. maybe the parents have to spend some time. So we'll later discuss what are the features that needs to be there in the waiting area. So after that, when the child is called in, the parents and the child come into the consulting room, and then they spend some time here. What do they do in the consulting room, we will see later. And then from the consulting room, then they're taking into the operatory. Then whatever the treatment has to be performed, the treatment is performed, and they exit through another door. So if you see, they do not go back the same way that they came in. They exit directly into the play area. So the child starts playing again while the mother settles the appointment and the payment, and then they finally exit. Okay, so this is called as a horseshoe traffic pattern, and try to remember that pediatric clinic should have a horseshoe pattern. It's very useful. It avoids the traffic congestion when you're going back to this from the same area. You can have a smooth flow of patients. So once you're in the dental operatory, maybe your dental hygienist or your dental assistant is sitting in the consulting room and trying to educate the parents about something while they are waiting for the turn to come in. Okay, so this is the horseshoe pattern. So some general consideration when you are planning your clinic: having glass doors which are soundproof with blinds are a very good method of having privacy, as well as having a very good look. So if you see here in this clinic, these are the glass doors on the front door. Okay, it kind of gives you a semi privacy. You can see what is happening inside, but you cannot see completely what is happening inside. So similarly, if you see here in this clinic, you also have glass doors, and then large glass windows. Okay, again, you can put in blinds to cover them for privacy, then uncover them for transparency. So this is a very good way, rather than to have a partition of wood or wooden doors. So it don't look very nice, and the children just don't like dark things like wooden doors. The glass, they are okay. So large glass windows. Try to keep the door knobs at a higher level, so that the children cannot open the door by themselves if you have those door knobs. So just to avoid children from exiting the treatment area on their own, or exiting the play area into the general corridor, so we can control their behavior. And then we can have wallpapers of fresh bright colors. If you see in this clinic here, all right, this is also very attractive, because the children, if you're asking them to use color pencils to paint and all, in the play area, they may start painting your wall also. So if you have wallpapers, you can change the wallpapers annually once, and then you can have a fresh look every year. So children may want to come back to you again and again, because things are changing for better. So these are some general consideration. And with this, we end this online session. And when we see each other face to face in the class, we are going to discuss the specific things that you have to have in the play area, in the waiting room, in the consultation room, in your operatory, and then how should the dentist and staff behave with the children. So we're going to look at it in more detail. So that's it for me for now. Wish you all have happy learning and stay safe. Okay. Bye bye from me now.